things that I would do if I was to wake up one day and then I'm overweight and then I have metabolic illnesses like I'm sick. I have issues with diabetes, hypertension, dementia, Alzheimer's. If I have any problem with any of these things, the things that I would do as an individual to stay healthy or be able to reverse and get myself off whatever problem that I'm going through. So they are as follows. The first thing I would do is making sure that I introduce fasting into my lifestyle. So the fasting can be either you do intermittent fasting or prolonged fast, but that will be dependent on whatever illnesses or whatever metabolic syndrome I am trying to deal with here. So the first thing is I would focus on fasting. And the fasting, it can be either practicing intermittent fasting or doing a prolonged fast. So prolonged fast will be things like a 24-hour fast, a 48-hour fast, or a 72-hour fast. Some people do days upon days of fasting. But the focus is to make sure that I add an element of fasting to my life. That's the first start if I should have any metabolic illness. So things like diabetes, hypertension, dementia, Alzheimer's, cancer, anything of that sort. My first protocol is to make sure that I introduce fasting into my lifestyle. And the reason I'll introduce fasting is that fasting is one way you can create an autophagic effect where old cells are cleared out and new cells are being made. And as you do that, you put the body under a reset control where you are creating that serious cell cleansing and cell cleanup effect. So it's very good to practice fasting, some sort of fasting in your lifestyle. It doesn't matter what type you choose. So you can either go the intermittent fasting way or the prolonged fasting. So intermittent fasting will be a little more shorter, where when you wake up, you don't eat for like about 5 to 6, 7 hours or even 8 hours before you have your first meal. So those are some of the things I will do for myself. And then the second thing I will do is to focus on having protein, making the micronutrient protein a main integral component of my routine. When it comes to my eating and my feeding, protein is going to be a focus. I'm going to make protein a focus when it comes to my eating. So there are 3 micronutrients here. There's protein, there's carbohydrates, and then there's fat. If you are in a metabolic space where you are sick from diabetes, hypertension, dementia, Alzheimer's, your focus should be making protein, the micronutrient protein, the top priority of your meal. Then the next thing I'll do is to reduce carbohydrates. So reducing carbohydrates means that I'm going to take out things like rice, potatoes, all those ones. I might reduce them. Depending on where I find myself with the issue I'm dealing with, I will want to reduce those ones and then tilt more to things we call cruciferous vegetables. So cruciferous vegetables are leafy greens like broccoli, kale, spinach. They have a lot of benefits. I mean, if you add things like cauliflower to your meals, apart from the fiber that you get from the vegetables, the fiber that you get, you are also going to increase a lot of vitamins like folate, vitamin C, vitamin K, a lot of benefits when it comes to introducing vegetables into your diet. So my focus will be to focus on eating cruciferous vegetables where I limit the other carbohydrates. So things like eating, let's say, spaghetti and stuff will be eliminated because refined carbohydrates are actually not good for you at this moment. So you might want to take that out of your eating. Then the next thing will be to stop or reduce alcohol altogether. And so my goal is, if it was me that woke up one day and then I noticed that I am overweight, I'm suffering from any metabolic illnesses like diabetes, hypertension, dementia, Alzheimer's, my focus will be to stop alcohol altogether. For me, stopping alcohol will be the top priority. I'll have to let go of alcohol altogether because alcohol creates a lot of problems. And then if it comes to cell destruction and then causing complex effects to your cell, alcohol is number one, and I, for one, will do away with it. Now, for some people, they might say, okay, I can't really do away with alcohol, or depending on the situation we are dealing with, maybe you're just overweight and you're trying to cut down back on the weight. Okay, then you can reduce it. So 2 drinks per week will do. My advice will be to do 2 drinks per week. So the next thing I will do is to eliminate any highly carbonated sugar drinks, high fructose drinks, or highly carbonated drinks, all these sweet drinks on the market. I will have to cut them off. So as much as you want to cut off alcohol, you would also want to cut off any high sugar drinks, because high sugar drinks create a lot of problems. And if you don't cut them out of your lifestyle, they're actually going to make it hard for you to even stay true to the cause and do what you have to do, because high sugar drink creates a lot of problem. The more insulin you have in your blood, the more your arteries are going to be destroyed. And if your arteries are destroyed, it will lead you to so many problems, which is you're going to suffer from hypertension. And then it also leads to high level of insulin resistance, which is then next going to lead you to suffer from diabetes. So my advice to anybody who takes a lot of sugar drinks to stop, because it will be something I will kick out of my eating altogether. Then the next thing is to quit smoking. I mean, stop smoking altogether. Smoking is not good. There's no amount of things people can say about it that will make it any better. Whether you decide to smoke marijuana or you decide to smoke tobacco, cigarettes, anything, smoking is just not good because it destroys your lungs. Smoking actually causes so much harm, and you won't want to put the body under high stress of inflammation from smoke. As you inhale the smoke, it creates a lot of problem. Even secondhand smoking is a problem. How much more you being the primary smoker? So smoking should be something you should let out of your life altogether. Then the next thing will be to weight train or lift weight. If not, then at least do body weight training. Now, I don't know if people understand the benefits that comes with training, like weight training. Weight training is one powerful way to put your body into an autophagic effect, because the moment your body can go into autophagy, then it means that your cells, the old cells are going to die, because you are going to make new ones, and the new ones are going to finish up the old ones and clear them, which is going to help you. It's also going to lower inflammation. You are going to lower so many things that go on in your body that create stress for you to suffer from all these metabolic illnesses and all these problems that you have when it comes to health. So training is very good. Training with weight is going to help you. It's one powerful ingredient that you need to really focus on, because training is very good. And if you cannot lift weight or train with weight, and you can actually train with your body weight, push-ups, press-ups, like dips, like there are so many things you can do by yourself with your body weight. And as you do them, you need to know that at least 3 times a week is very good. And then the next thing is to make sure you have what we call progressive overload in your mind. As you train with weight, your goal is to be healthy. Your goal is looking at how beneficial can I train to make sure that I get healthy. So if you are training to stay healthy, you also have to make sure that progression is important, is a key driver of what you are trying to achieve when it comes to being healthy. So if it was me who woke up one day and I realized that I was overweight, or I was suffering from things like diabetes, hypertension, dementia, cancer, or whatever it is, the first thing I will do is to fast, intermittent fasting or prolonged fasting. The next thing I will do is to make sure that protein is increased in every meal that I have. Then the next thing will be to reduce refined carbohydrates or carbohydrates altogether and focus on fruit, vegetables. At least vegetables are very good. Cruciferous vegetables, to be precise. And then the next thing will be to reduce alcohol, and then reduce high sugar drinks, and then stop smoking altogether. And then weight train or body train at least 3 times a week. Then the next thing I will do, if I am the one who is in this situation, is to stay active. I have to make sure that I stay active. And staying active means that you introduce things like walking, because it's one easy way for anybody to stay active. So being active is one powerful way to get well, because we are not beings that were designed to be sedentary. We were not designed to be sitting the whole day doing nothing and being on our phone and scrolling whilst not doing anything. And now, with the change in lifestyle and the blue collar work we have now, people sit almost throughout the day So the next 24 hours, somebody will be sitting. And this goes on for weeks, for months, for years, and out of their life is all about sitting. So it's important to make sure that you stay active. So things as simple as walking helps. If you work in the office, you work a while, every 30 minutes in the office, you can wake up, use the stairs and walk up. Instead of using the elevator, try as much as possible to use the staircase. As you walk on the staircase and you use the staircase, it helps you stay active. And you can do this over and over and over, and that can be an easy way for you to stay active. Now, for people who work at home, you can set a time where after you work a while, you move about a bit, or you can even design to walk either early in the morning or late in the evening. Those are easy ways you can incorporate walking into your lifestyle, and then you stay active with that. Now, the next thing is sleep. And I'll be talking about quality of sleep and then the duration of sleep. For some people, 5 hours of sleep is enough for them to be healthy. And for some people, 8 hours will be something they need to stay healthy. So it depends on where you find yourself. But quality sleep is as important as duration of sleep. You don't necessarily need to sleep for 8 hours, which is normally the advice that we give everybody that try to sleep for about 8 hours or 9 hours a night. But for some people, they might need less. For some people, they might need more. So you need to know where you fall within this angle of advice, and then you make it a priority to have good sleep. Now, if your sleep is not good, you can do things to actually help induce the sleep. And something as walking, that's why, like I was saying, you can walk at night. So if you try to walk, like maybe after your last meal, you walk 30 to 40 minutes in the evening, that's actually going to help you stimulate some receptors and stress in your body. That's actually going to help you go into a deep state of sleep. So sleep is important here, and you need to make sure that you make it a priority so that you have a good restful night's sleep. Now, the next thing will be to introduce supplements. And supplements like magnesium is very good for sleep, and you want to introduce some level of supplementation. It depends on, and for supplements, my advice is it depends on where you find yourself in terms of all the things that you're doing, the changes that you're doing, you are incorporating into your lifestyle to help you deal with the issues that you're facing. So it will be dependent on where you find yourself at this moment, and then that will dictate which supplement you would want to introduce in terms of like what you are doing as of now. So that's my take. And then the last of it is to either work with a coach, work with a therapist, work with a physician who understands medicine or health from outside the scope of medicine or outside the scope of medical school curriculum. Because if you don't work with a coach who understands health from that angle, it's going to be a problem, because he might not be able to advise you based off from, okay, if I should administer these medications to you based on what you're having, what other things can you do aside medication? Because there have been several researches that have been done, and all through the researches, there's a key factor that always shows up. And the key factor is that you cannot use only medication to deal with metabolic illnesses. You need to actually apply lifestyle as well. And food is like the baseline causation or causality of any problem when it comes to metabolic illnesses. So it's important to make sure that you work with somebody who understands medicine outside the scope of the medical curriculum. If not, it's going to be very difficult for you to actually help deal with these issues and reverse them, because nobody has ever been on medication totally and they've been able to deal with their diabetes, hypertension, Alzheimer's, Parkinson, cancer. It always gets bad. You can't fight something when the root cause of what you are doing, you keep doing them. It's like Einstein said, like, you keep doing something over and over and over again, expecting a different result. If the things you did that brought you to wherever you find yourself, which is being overweight, having dementia, Alzheimer's, whatever it is, the problem you are having, and you keep doing them, nothing is ever going to change. So my advice to everybody is that you need to work with somebody who understands this field of things. And since I have gone through it, it's been my experience that if I should wake up one day and I am obese, I have any of these metabolic syndromes, which is like diabetes, hypertension, dementia, or Alzheimer's, the things I will do will be to fast, either intermittent or prolonged, increase my protein, focus on eating more protein, reduce carbohydrates or refined carbohydrates, and then focus on having things like cruciferous vegetables. Stop alcohol. Stop all refined sugar drinks. I'll stop them. I'll take them out of my lifestyle. I'll stop smoking. And then I'll focus on weight training or body weight training for weeks and making sure that at least 3 times a week, and also making progressive overload a focus in there. And I'll stay active. Do things like walking, which will help me to sleep, and it will help me to enhance my sleep. And I'll introduce supplements. I'll introduce so many supplements, because if at the point of where I find myself, I need to introduce supplements to help me recover and boost my recovery very fast, I'm going to do that, because it's very important. And the next thing is to make sure that I work with a coach, somebody who understands the things that I am trying to do or trying to achieve. So those are my advice to anybody who is probably overweight, is suffering from either diabetes, hypertension, dementia, or Alzheimer's. Something that I would do if I were in that person's shoes is what I'm saying.